the importance of categorizing eczema and tools that can help. Eczema, more accurately called atopic dermatitis, AD, is a major risk factor for developing food allergies. The LEAP study focused on infants with AD, and the addendum guidelines rely on pediatric clinicians to identify and categorize infantile AD to help guide families. While many pediatric clinicians feel comfortable diagnosing AD, categorizing it as mild, moderate, and severe might be a bit more challenging. This module will provide a thorough review of AD and a specific clinical scale that can help determine who has severe AD and needs testing prior to peanut introduction versus who can have peanut products introduced at home without testing and referrals. AD is a chronic pruritic inflammatory skin disorder, often with a relapsing and remitting course. The prevalence in American children is between 10 and 13%. Affected children have a 5-fold increased risk of developing a food allergy, and this risk is further increased in those with early onset and severe AD. The diagnosis of AD is based on 3 essential features. Number 1, pruritus. AD has been called the itch that rashes. Number 2, eczema. Dermatitis, inflammatory skin lesions. And number 3, typical morphology and distribution, such as erythema, papules, vesicles, erosions, and lichenification. They can develop post-inflammatory, hypo or hyperpigmentation. Now, the distribution differs based on age, and that can be seen in this image. So in infants from birth to 2 years, you usually see it on the face, the cheeks, the scalp, and the ears. Extensor extremities and seborrheic dermatitis can overlap. Now in childhood, 2 years to puberty, you can continue to see it on the face, cheeks, but it moves into the flexural extremities. And teenagers to adults, it's localized flexural extremities, hands, and even the dorsum of the feet. Other clinical features that support the diagnosis include a rash that flares and remits, the hallmark history in a patient with AD, and a positive family history for allergic disease in either one or both parents. There are some variations in AD of which to be aware. Some children with AD show nummular or coin-shaped lesions with sharply defined oval scaly plaques on the face, trunk, or extremities. Erythema in children with skin of color is much more difficult to see. The typical bright red seen in light-skinned is muted, duskier, sometimes purple-covered, and more difficult to appreciate as pigmentation is darker. Follicular accentuation may be present, and lesions may be more papular, and pigmentary changes, including hypo or hyperpigmentation, as well as ashy or gray-brown discoloration, may be seen. In addition to diagnosing AD in infants and recognizing the increased risk for food allergy, NIAID guidelines require pediatricians to categorize eczema as severe versus mild or moderate. There are very detailed scoring tools like ScoreAd or Easy that can be used to do this. However, it's not practical for these to be used in daily clinical practice because they require both time and extensive training. Simpler atopic dermatitis scoring systems have been used and evaluated. These include the 3-item severity score and the Validated Investigator Global Assessment for Atopic Dermatitis, the VIGA-AD. The VIGA-AD was developed by Eli Lilly and Company and evaluated by dermatology experts. The clinical scoring tool is divided into 5 categories, ranging from 0, clear, to 4, severe. 0, clear is really no inflammatory signs of atopic derm. 1, almost clear, barely perceptible erythema, barely perceptible induration papulation, and or minimal lichenification with no oozing or crusting. 2, which is mild, is slight but definite erythema, which is pink usually. Also induration and papulation, slight, and or slight but definite lichenification. Again, no oozing or crusting. And then 3 gets into moderate, which is clearly perceptible erythema, dull red, clearly perceptible lichenification and papulation, and or clearly perceptible lichenification. Oozing and crusting may be present in 3s. 4, which is severe, is marked erythema. The color is usually deep or bright red, marked induration, papulation, and marked lichenification. The disease is widespread in extent. Oozing and crusting may be present. In this education module, we will focus on how pediatric clinicians can apply the vIGA-AD when doing infant exams in order to determine mild, moderate, and severe eczema. In doing so, pediatric clinicians can then implement the NIAID peanut prevention guidelines. So first, we have mild. In these images, the erythema, papulation, and lichenification is definitely there, but it's slight. If you were able to touch the lesions, you would note mild induration as well. There is no oozing or crusting. This is mild atopic derm. Moderate. In these images, the erythema is clearly present, as are the papulation and lichenification. During the examination, you would also appreciate induration. Children with moderate AD may also have oozing and crusting, which can be seen in these images. Severe eczema. AD is often bright red or deep purple, depending on the skin color, and there is marked papulation, lichenification, oozing, and crusting. On examination, marked induration would also be noted. The lesions are widespread. Since determining severe AD is critical for adhering to the NIAID guidelines, here are some additional tips. If oozing crusting is present, then the AD is either moderate or severe. Keep in mind that oozing and crusting can also be caused by infection, so that can be a confounder. If unsure between moderate and severe disease, use extent to determine the severity. If the lesions are widespread, then it would be appropriate to diagnose severe atopic dermatitis. Also consider if darker skin is modifying the visibility of the erythema. Marked erythema can appear as dusky or deep purple. Also, other factors in the clinical history can help you determine if the eczema is severe. For example, the NIAID states, severe eczema requires frequent use of prescription steroids, calcineurin inhibitors, or other anti-inflammatory agents, despite appropriate use of emollients. We know that this is a lot of information. In order to support busy practitioners, we have included the vIGA-AD and example images on a scorecard, which is available to you in your clinics and via your EMR. Thank you for watching. We hope this video and the AD tools described will support your ability to apply the NIAID peanut prevention guidelines.